Okay, so now we're going to talk about what to do in an abnormal assessment when your patient has some things that are abnormal in your assessment findings. So, when your patient has yellow nasal discharge, sneezing, or sinus pain, first off, reposition them into semi-Fowlers or another comfortable position, something that can relieve sinus pain, getting them up where they can breathe better, elevating them so that they're not laying flat can help them to breathe better. Checking their vital signs, particularly their temperature, is going to be important. Notifying the charge nurse of these new findings, important, of course. They're probably going to want to, they may want to check a sample of those, the nasal discharge, or they may want to start them on an antibiotic. So your patient has a severe headache and dizziness when standing. One of the first things you're going to want to do, obtain vital signs, especially blood pressure. This could be a problem with high blood pressure. You may also, in addition to simple set of vital signs, you may be asked to get what's called orthostatic blood pressures, which means you take their blood pressure lying down, you sit them up, they sit up for 2 to 5 minutes, and then you take their blood pressure, then you stand them up, and again you wait for 2 to 5 minutes, and then you take their blood pressure. Now, it's usually blood pressure and pulse, and if the person gets dizzy, or if there's a change of more than 20 points in blood pressure or 20 pulse points, then it's considered a positive for orthostatic hypotension. So if they get dizzy, certainly you're going to return them to their bed. You usually want to do this with 2 people in case the person does get dizzy and pass out. But you would, of course, want to make sure you had enough people with you to catch the person if they were to pass out. But those are orthostatic blood pressures and pulse, called orthostatic vital signs. You return the client to bed in a comfortable position if they get dizzy or get a headache when they stand. Identify any contributing factors like stress or pain, or if that blood pressure is in fact elevated, and of course notify your charge nurse. Hypoventilation. So they're not breathing enough, they're cyanotic, they may have an altered level of consciousness, they're confused, or they're not really with it. Stay with the client, so don't leave them alone. Call for help. Position them in semi-Fowlers or another comfortable position. You want to get them sitting up so they can breathe better. And consult the charge nurse. We may initiate oxygen therapy. If you're initiating emergency oxygen therapy, remember that when we initiate emergency oxygen therapy, until we know more about the client, we usually only initiate at 2 liters. You have to be careful about initiating oxygen on patients that you don't know their history, because if they were COPD or if you initiate high levels of oxygen, it could be dangerous for them. So we always initiate at 2 liters of oxygen until we know more about the patient. But you would always consult your charge nurse if they're available. And then, of course, we would monitor their vital signs. So here's another one: copious mucus production, audible inspiratory wheezes, or congested cough with thick, tenacious mucus. First of all, assisting the client to cough by splinting their chest, teaching them how to inhale through the nose and then exhale and cough. So teaching them the cough and deep breathe to try to get these secretions up, and encouraging them to expectorate that sputum, and using tissues or spitting into something to get that sputum out. And then auscultating breath sounds before and after a cough to evaluate the cough's effectiveness. So you listen, then you get them to do the slow inhale and then exhale and cough, and then listen again to see if they've been able to clear some of that. Encouraging fluids is also important. If we've got thick, tenacious mucus, the more fluids we can get them to take, if they're not on fluid restriction, then the better chance they have of thinning those fluids out and getting them out. If they're unable to clear their airway themselves, suction may be ordered, so we may be doing suction of those secretions, and of course monitoring vital signs and notifying the charge nurse of your findings as far as their effectiveness of their cough, what you're hearing before and after those coughs, and if they're able to expectorate that sputum or not. Okay, so here's a patient, cardiac pulsations, vibrations, or both are palpable. First off, obtain vital signs and be prepared to assist with an ECG, because we're probably going to check an ECG to see what the cardiac rhythm is. If the heart rate is irregular or the rate is less than 60 or above 100, that can be significant. Check the blood pressure. If the blood pressure is low, arrhythmia may be contributing to inadequate cardiac output. So we might be seeing an atrial flutter or AFib. Observe for sensations or reports of dizziness or feeling faint. Stay with the patient. Make sure that you're watching them if they're trying to stand up, that they don't pass out, and notify the charge nurse. So pulse issues. If a pulse deficit is present, obtain vital signs. Be prepared to assist with an ECG. Palpate pedal pulses. If previously palpated pedal pulses are diminished or absent, elevate the extremities and notify the charge nurse. And we'll check them with a Doppler. It may just be that they're difficult to palpate, but they're there. So we always want to check those with a Doppler if you're having difficulty obtaining those. Any pulses that you're having trouble obtaining by palpation, we always want to come back and check with a Doppler to see if it was just difficult to feel those pulses or if they're really absent. As far as the legs and feet, if their lower extremities are pale, cool, and have thin, shiny skin and reduced hair growth and thickened nails, that indicates chronic arterial insufficiency. One of the things we want to pay attention to is proper foot care, and they should be watching their signs for impaired skin integrity. If they have these signs of impaired arterial sufficiency, we want to treat them just like we do a diabetic as far as foot care, because these are patients who could, if they get any wounds on their feet, those wounds are going to have trouble healing, and they could go necrotic very quickly. We want to contact the charge nurse for a podiatrist referral for nail trimming. We don't want to trim the nails on those patients without an order, because if you were to cut them or not cut those nails correctly, that is a wound that could go necrotic very easily, because there's not enough blood flow there to heal that properly. Abdominal problems. If they have a abdomen that protrudes symmetrically with skin taut, or the client complains of tightness and or bowel sounds are absent, remember that we can check that abdomen with percussion to tell if there's fluid or air in there. If bowel sounds are absent, remember that's a problem, because that means that that bowel is not working at all. GI motility has ceased. The client may be vomiting. If they're vomiting, we may be getting an order for a G tube, an NG tube to go down to help to clear the pressure. The person's going to be NPO and notify the charge nurse, and they may order an NG tube to help to reduce some of that pressure. It could mean that there's a blockage that's going to have to be dealt with. And that's going to be a person that we're going to want to make sure that they're NPO. We don't want them to put anything down into the stomach until we figure out why their bowel sounds are not present and why the GI motility has ceased. If a person has joint issues, prominent swollen and tender joints, not with nodules or bone overgrowth, these are signs of arthritis. One of the things that's kind of the catch-22 of arthritis is the joints hurt, so I don't want to move, but unfortunately that only makes the joints hurt more. So we really want to instruct the client in proper range of motion, because keeping those joints moving will actually help to reduce the pain. The client will probably have anti-inflammatory meds ordered, and we want to make sure that they know about those anti-inflammatory meds. So we want to determine their knowledge of anti-inflammatory meds, and those should be taken regularly to help to reduce some of the inflammation. If the patient has reduced range of motion in one or more major joints, we should assess for pain during movement. The joint may be unstable, stiff, painful, swollen, or obviously deformed. Notify the charge nurse. Reduce mobility in the extremity until the cause of the abnormal joint motion is determined. We don't want them moving it if it's obviously injured or deformed, but if it's arthritis, they should be doing regular range of motion to keep those joints mobile, because it will actually help reduce the pain. For muscle weakness, if a client demonstrates weakness in one or more major muscle groups, the gait demonstrates unsteady balance with a shuffling or stumbling, notify the charge nurse, particularly if this is new for the patient, and provide for client safety when ambulating. Make sure that you're with them. Use a gait belt to provide you with a good grip. Remember, it's a gait belt, not a lift belt. So you're not trying to lift the patient with that belt. It's only to give you a handhold while you're walking them in the event that the patient would lose their strength and start to fall. You could safely lower them to the floor. So make sure that you're using safety when ambulating. If the patient has neurologic deficits, like changes in mental status, or papillary response or other neurologic deficits, notify the charge nurse immediately, place them on fall precautions, monitor vital signs, and monitor their level of consciousness closely. So you're going to continue to check their level of consciousness and their vital signs. And we check things like pupil response, grips, to see if they're equal. We look at things like that, sensation, to check neurologic response. So that concludes alterations in body systems. There will be a quiz that will be up on Moodle that you can take on this information, and that's it. So I hope you all have a good day. Thank you.